Hello, my name is Amanda Harris. I'm a student at Parkland College. Today I'm going to do a competency video on giving a patient a small volume nebulizer treatment. So the first thing you want to do is go over the patient's charts. You want to go over the doctor's orders. You always want to perform proper hand hygiene. Okay. Hello, my name is Amanda. I'm a respiratory therapy student. Would you please verify your name and date of birth? Okay, thank you, Mr. Wilson. So I was looking at your charts and I see that your COPD is flaring up. Yeah. Okay. Just trying to get an idea, on where you're at. So is it bothering you so bad like you can't do errands as far as going to the store? Or is it really bad to where even getting around inside your house is wearing you out? Okay, just gives me an idea. All right, well, give me a minute here and we're going to get your vitals. So at this time, you want to check your patient's SpO2. You want to get their heart rate and their respiratory rate. Okay. Okay, so if you go for about 15 seconds, you can multiply that by 4. Same thing when you're getting the respiratory rate. If you can take 15 seconds to look at it, then you can multiply it by 4. All right, thank you, Mr. Wilson. The next thing we want to do is listen to their breath sounds. How that's done is you start at the top, you go side to side and work your way down. There's a total of 6 sites on the front and a total of 8 on the back. Okay. You take a deep breath for me. Another deep breath. Thank you. All right, I'm going to check back here for you. Here, you take a deep breath. And another. Okay, one more. And again. All right, thank you. Okay. All righty, well, we got that all documented. So next thing is we're going to go ahead and get you started on a nebulizer. Have you had one before? It's been a little while? Okay, well, let me get you started here. All right. So today we're using albuterol. We're going to use a whole vial. All right, so we're going to set this to about a 10 liter a minute flow. We have to make sure that we have adequate mist coming out. All right, Mr. Wilson. So if you just hold this for me, now what I need you to do is wrap your lips around this tightly and breathe in and out regularly. Maybe every couple minute or two, take a nice deep breath and hold so we can really get this medicine depositing in your lower airways. It's going to make you feel so much better. All right, do that for me, please. Okay, and so how you're going to know that the treatment is over is it's going to start to sputter as the medication's empty. You'll see, it will no longer be spraying the mist. For safety reasons, especially if you don't know the patient very well, you're going to want to check halfway through the treatment. The treatment's probably 10 to 15 minutes, so 5-6 minutes, reassess the patient again, look for elevated heart rate, respiratory rate, that kind of stuff. Okay, Mr. Wilson, so while you're doing that, I'm going to get you set up on some oxygen that the doctor ordered. Okay. All right, so we're gonna fast forward and pretend the treatment's over. We heard it sputtering. All right, thank you, Mr. Wilson. You did a great job. Okay, so the doctors wanted you to have a little bit of oxygen. Okay. All right, so I have this set at a 2 liter a minute flow. Again, the patient has COPD. We only need to get his oxygen up per the doctor's orders, about 2%. So I chose to go with a 2 liter flow. We're gonna check in about 10 minutes, 20 minutes, about 20 minutes, and make sure that, if things are going up, the patient's getting good flow. The patient's SpO2 is improving. Alrighty. Here, let me get this, whoops. Sorry about that. I think this is my first rodeo. Alright, so now we should have you breathing together. I need you to give me a good cough. Here's your napkin. If you've got any yuckies in there, you just go ahead and cough it in this. Okay, so we pretend he does. If we get a lot of secretions out, then we're going to go ahead and look at it, maybe check the color, check the consistency. Gives us an idea, if the treatment's working and we're getting the secretions moving. I'm sure the patient would have a sanitary replacement bag that we put this in. You wouldn't put it just in the trash because it's a biohazard. So, all right, so we've done that. All right, so now we're going to check the patient again. We're going to check his SpO2 levels, see if they've gotten better. Again, we're going to do the heart rate and the respiratory rate. Like I said, you can watch for 15 minutes, multiply by 4. Okay, so we're going to pretend we've done all that. Now we'd also listen to the patient's breath sounds again, in the same way that I demonstrated the first time. Everything seems to be improving. We have no trouble. So I'm going to talk with Mr. Wilson, let him know that, I'm going to come back here and check on your oxygen in about 20 minutes. Okay, I'll put some things in your chart. All right, just breathe regularly. And for right now, try to breathe just mostly through your nose. Let's get your oxygen up. No mouth breathing. Okay, we'll see you shortly. And you would also want to get rid of your gloves and sanitize your hands again. We don't want to spread infection.